March 18th, 2016. Hi, this is Stephanie.
Hi.
Stephanie, how you doing?
Pretty good.
Good. Good to have you. Thanks so much for being willing to share your
Definitely.
story with our listening audience. So,
Mhm.
Stephanie came in November of 2006 or 2015, about 3 months, 3.5 months ago. And Stephanie, would you like to just share your story?
Yes. In my early 20s, I experienced C-diff, and that was really debilitating for my intestinal health, obviously. I also was struggling with whether or not I was gluten intolerant, and I had been diagnosed with IBS, which felt like an empty diagnosis to me and with no help of what to do about it. And I also traveled to Mexico for the last 3 years. I've traveled to Mexico several times a year, and every time I've gone, I've gotten sick. Whether that's from the water, or I don't know, but every time I would get sick. So that was also really frustrating. And that's what finally led me to come to Dr. Seeley.
And then how did you ultimately decide to come here?
So I had been on another trip to Mexico and thought I had made it through without getting sick. But when I got back, I got more sick than I've ever been. After a trip, I've been avoiding gluten and my C. diff had cleared up, but I was still experiencing just severe stomach issues, diarrhea and nausea a lot of the time. And so a friend told me about the clinic here and what could be offered. And so that I just was knew that this was the place that I needed to come to for a change in my
Cool.
health.
So what did we do for you, Stephanie, that was different? You said you'd been to multiple different medical practitioners. Is that true?
Yes, I had visited in my home state of Montana as well as here several very specific intestinal health people and tried a lot of different diets and different things to try to improve my intestinal health, and nothing worked, or I would just kind of lose contact with the doctor and wouldn't know what to do next. So here was very different than that. I right away had a lot of hope and a lot of I was educated about what was happening in my body, which gave me the motivation as well as the tools to be able to change how my intestine reacts to my stress, as well as what
What did you discover about yourself?
a lot of things. I
Anything in particular that has really stuck out for you as you've made your changes?
Yeah, I've definitely discovered that I know that my job and a lot of people's lives are high stress, but changing in diet and changing in having a reason to change gave me
Of
a lot
relief.
of relief. Exactly. Hmm.
And so we did testing, we did micronutrient
Yep.
testing, we
Yes.
did food sensitivity testing, we
Hmm.
did some basic lab work, and we actually did a stool test.
Hmm.
And we discovered that there were a number of imbalances
Yes.
occurring in your GI tract.
Yep.
You embarked in a journey
Hmm.
starting December, true?
Yep.
And you want to talk just for a minute about that and how difficult that was for you and how that's worked?
Yeah, I in the past sometimes it's been hard for me to like avoid gluten or things like that, and this diet and regime was a lot easier because there was a reason behind it, and because there was so much support here at the office. And it's just really easy to use. You get a list of the foods you eat each day, and I've even been able to like give it to my friends, and they help me find different things to eat and give me ideas, and that's really been helpful. The support from the office has been just above and beyond what any other place I've been to has
Cool.
shown.
So, how much improvement would you say you've had since November as compared to now today, 3.5 months into
Mm-hmm.
your journey of recovery?
Mm-hmm.
What level of improvement would you say? 0 to 100, 100 being, perfect ideal. You don't think you could be any better.
Mm-hmm.
Zero, no improvement at all. What percent improvement would you say you presently have?
Yeah, I would say I'm at least doubly better, maybe even 60% better.
60%?
Yeah, so 60.
That's awesome.
Mm-hmm.
And do you have any advice, Stephanie, for future patients or people who are struggling with intestinal complaints?
I think just knowing that you have ownership in how you feel is something that I learned here, and that's great advice that I would have liked to have, several years ago. That you can do something about it, and you can help yourself feel better, and that's what I learned most here.
Cool.
And I
That's
wish I'd come
awesome.
sooner.
Cool. Do I have your permission? Thanks so much for
Mm-hmm.
sharing. Great job. I'm proud of you. You're making wonderful progress. Seriously.
Mm-hmm.
So great job. Keep it up. Um, Do I have your permission to share your story with doctors, students, or patients anywhere?
Yes,
Any
you have
restrictions
permission.
on that?
No,
Thank you so much, Stephanie. God bless
thank
you.
you.